This video is for you. This is the time to start thinking about hospice. That is how you know it's likely time for hospice. Another thing you want to think about is quality of life. What is their quality of life? If they're not able to tell you whether or not they'd like to live this way, because maybe they have severe dementia and they can't tell you. If you know they would never have wanted to live the way they are living, respect that. Don't force them out of guilt, your own guilt. I'm not shaming you here. I understand. I'm letting you off the hook. You don't have to keep taking them into the hospital to get them hydrated or get them to get an IV antibiotic or get them to PT so they start walking again. I personally don't think that's something we have to push. Specifically, if you know that your loved one wouldn't want to live like this. Quality of life matters. And I think our Western society pushes life at all costs, meaning like they should be alive, like that's the highest good. Whereas I think, what's their quality of life? What's their quality of life? Maybe they wouldn't want to live like that. So being alive isn't the highest good. Now that I think about it, that does sound a little harsh. So I think what I'm trying to say is sometimes us keeping someone alive at all costs, that actually kind of harms them more than helps them. It is about quality of life, but it's also about, are we actually doing more harm than good? You know, we have to weigh the risk versus benefit. If someone has advanced dementia and they keep getting UTIs, which is a urinary tract infection, very common. And then that urinary tract infection turns into sepsis, which is an infection in the blood, which makes someone very sick. They have to go into the hospital. They get IV antibiotics. They start getting a little better. Then they're discharged from the hospital. Now they're even more weak, declining even more, because it does take a lot out of you to be in the hospital and to have sepsis. Weighing the risk versus benefit. So the benefit of going into the hospital, they get the infection cleared up. The risk of going into the hospital, they have to go to the hospital. It makes them more weak. They may get agitated and delirious in the hospital, because many people do. Then when they get out of the hospital, they're even more weak. That is a risk. That is a risk. So it gets to the point of like, what's more, like the risk versus benefit? And it's truly up to you. It's up to you and it's up to your family. I think it's important to talk about it, to help start understanding that doing everything possible isn't necessarily the best thing and could actually cause someone to decline more. Another thing you have to ask yourself, and this is a hard one,